Welcome to Your Healthcare Matters. I'm your host, Jenna Sims, and I've worked in healthcare for over a decade. And like many of us, I'm really concerned about the deterioration of our healthcare system. On this podcast, we interview patients, healthcare professionals, and advocates to provide unique perspectives and helpful tips for navigating our failing healthcare system. My goal is to inform, connect, and inspire listeners to take your health into your own hands. My guest today is Dr. Adrian Fine, who earned his medical degree from Trinity College, Dublin in 1968. He trained to become a kidney specialist in Oxford, Glasgow, and the West Indies. He practiced in St. John's, Newfoundland for 5 years before moving to Winnipeg, where he became head of the kidney department at St. Boniface Hospital. As a visiting professor, he taught in India, Uganda, and Tanzania. He has published dozens of research articles, including some on medical ethics. He worked with Dying with Dignity Canada in legalizing medical assistance in dying, also known as MAID. He retired in 2012, but remains an active member of BC Healthcare Matters. Dr. Adrian Fine, thank you so much for inviting us into your home today.
Thank you.
Can you start off by telling us how your experience working in other countries has influenced your perspective on healthcare delivery?
It might be worth telling you why I moved so often, because that will explain why I'm here and why I'm being interviewed.
Sure.
I went to what used to be a very famous medical school in Trinity in late 1800s. It was one of the top medical schools in the world. However, time passed by and the medical school reduced its reputation to almost losing its accreditation. And there was no ability to, after graduation, stay and become a specialist. There was absolutely no training programs. And the standard of medicine was pretty awful because everyone was in private practice rather than working for general public. I then went a gigantic leap to Oxford, which is actually probably the best single medical school in the world. And that was amazing. It was a cultural difference. The care for patients was dramatically better than I was used to. Because of the difficulties getting training jobs in Britain, I ended up not getting another job there, but did the rest of my training in Glasgow, a good medical school. Now, why did I leave Britain? I left Britain because its healthcare system, specifically for dialysis patients, was the worst in Europe. And if you were over the age of 50, you were turned away for dialysis, usually with the lie that your kidney failure was not the type of kidney failure that would respond to dialysis, a complete lie. And that put me in an ethical conundrum so that when I became a specialist, it was me taking responsibility for unethical decision-making. And so I moved to Canada because at that time, Canada, now we're talking about 1978, Canada was in the top 3 or 4 healthcare delivery systems in the developed world for all the measurable outcomes, life expectancy, a number of people with obesity, a number of people on dialysis, a whole pile of parameters. We were in the top 3. It is ironic, though, that in the past 30 years, that standard has declined exponentially. And we are now, with the OECD countries, we are in the bottom 3 in almost all measurable outcomes. And it's very sad. Now, you asked me, with going to all these countries, how it affected me. One of the things I can look at positively in the healthcare system in Canada is that when you go to a country like Tanzania and Uganda, there's no healthcare. You're talking about one kidney specialist in an entire country of 35 million. You're talking about 50,000 patients per general practitioner.
Wow.
The average for North America is somewhere between 500 and 1,000 patients. So you see two sides of the world, one in which there's nothing, I've seen the best, as in Oxford, and now I've seen a decline of one of the best to very substandard.
So, based off of your experience in all of these different countries and watching the deterioration of the healthcare in Canada, what do you think are some of the factors that played into that deterioration over the past 30 plus years?
Well, we could be all day and make a 5-hour movie on this one. It's a combination of factors, but the two things I want to mention, and that is people always think if we poured more money into healthcare system, then things would get better. And we get reinforced every few years by our provincial governments whining that they're not getting enough money from central federal government. But if you look at the overall expenditure for healthcare, Canada spends one of the highest percent of its GDP, gross domestic product, on healthcare delivery. And in spite of that, our healthcare system and its outcome measures are worse than many, many countries in Europe, Australia, South Korea that spend less per capita. So it's not just money. Then what is often stated is it's too few doctors. Well, yes and no is the answer to that. There are too few primary care doctors offering primary care. But if you look at the number of registered primary care physicians, we have sufficient numbers. We're better than most countries in Europe. We technically, if you do the math, we have one registered family practitioner per 500 patients. The problem with the data is many of those family practitioners are working very part-time. And the government, instead of coming up with saying there are so many thousand doctors and it's wonderful we have another 150, they should be coming out with full-time equivalents. And that will be a marker of how good or bad we are. Because we know there's nearly 1 million people without family doctors, in spite of knowing that there are a number of doctors out there who could be offering, in the correct system, could be offering primary care. So what I'm trying to say in a somewhat long-winded way is it's not just money and it's not just number of doctors. So if it's not those two prime things, then you have to look at, is it poor management? Or is the system the one that we should be rigidly adhering to? There are plenty of systems that we could compare ourselves with in Europe, Australia, etc., who do better and don't have the same wording and policies as the Canadian Health Act. And I think our politicians should be looking outside the box to see what can we do with the big resources that are there, but are not put to optimum use. And it's a tragedy because our politicians, they will come up with something like $500 million to expand some program somewhere. Well, $500 million, it sounds a huge amount, but when you consider that the healthcare budget is 30 billion here in BC, really that hardly keeps up with cost of living. So our politicians, they're the ones that are making this big decision and these poor decisions. They're not accountable to anyone. They have a degree of privacy and work their own way without accountability and transparency. And God bless Canadians. We're lovely, polite people, but we should be out there protesting because it is the number one expenditure of our taxpayer dollars. And each and every human being in planet Canada will depend on having a doctor at some stage in their lives. Yet we remain poor profile. There should be daily demonstrations. There are letters to some newspapers, and then that's it. And one of the most despairing things I personally find is that the government does tell lies. And I will just give you one example. I personally need one of my joints replaced that has bad arthritis. And so I looked up, there's an official site you can go and examine to see what's the waiting time for the particular doctor I was going to for that particular procedure. And if I did that before I visited him for consultation, 6 months was the official up-to-date figure for that surgeon. I mentioned that to him when he told me, you're going on the list. He said, you must be joking. It's at least a year.
Wow.
And he said, those figures are laughable and not true. So it's very difficult to put trust in a system, and a system that does that is not a system that's being honest to its population.
I mean, I feel like you make some really valid points there. It sounds like a very multifaceted
Yes.
issue. So, talking about better accountability and maybe more strategic planning for finances. Like you mentioned, like it's not a money problem, it's maybe more so of where the money's going or how it's being allocated.
Yes.
And then also the statistical data that you mentioned, I think was really interesting too. So taking into account part-time physicians versus full-time physicians and coming up with a more accurate number of how many family physicians we need to service those, up to 1 million BC residents who are unattached at the moment.
Okay. So maybe you'll allow me to add one other dimension to this. And that is with the crisis that's occurred in the last few years. And by the way, 15 years ago, when I met someone, a young doctor in Africa, she was volunteering with me, and said, we're moving to Victoria, her comment was, and this is now 15 years ago, her comment was, you'll never find a family doctor. That's 15 years ago. And fortunately, I used a connection with her to get a family doctor and had one for about 6 years. But this isn't an acute problem. It's been there for ages. And so quite recently, meaning the last couple of years, the government has announced measures to increase the number of doctors who qualified outside Canada want to come back to Canada, overseas qualified people, and also build another medical school here or there and make the practice of family practice more attractive. But 180,000 people are coming to BC every year as new citizens of BC. If you then work out that you need one family doctor for every 1,000 people, that means you need 180 family doctors just to keep up with the immigration into this province. You add that to the deficit of full-time equivalent doctors, the way the government is operating, we'll never get there. We will have a shortage of family doctors for decades to come. And therefore, it makes you think of what could be a better system. And one system that really, and some of the medical colleges have come out with recommendations, and it's done in many countries, is to have like healthcare centers where there are multiple doctors, family doctors, maybe the occasional specialist, nurse clinicians, physician assistants, maybe a physiotherapist, where basically patients can go and be seen in a much more cost-effective way. And if their doctor goes on vacation, there's always other doctors who have the entire medical record. You could also have laboratories in there for basic clinical measurements. And this would be a dramatically cost-effective way of seeing more patients for a given number of doctors. And the doctors might well feel good working in such a clinic. I spent my whole professional life working with a group of doctors, and I never got involved in anything to do with business management. I was working full-time doctoring. I worked in a hospital, so the management and the finances were all taken off my portfolio, whereas everyone most people who are family doctors in Canada are self-employed business people, and they're not trained to be business people. And so if you had this huge group practice, and so if you have a group practice, then you also employ a business manager. And so you take all that away from doctors having to waste their time in an area that they're not qualified to do properly and are not efficient in their usage of time in that particular aspect of their work.
Right. So team-based care can really help everyone share the load.
Absolutely. And it's what you talk to patients who've been to a clinic with team-based care, and they will say it was wonderful.
Yeah, I can attest to that having received care in the US. I
Yes.
went to a large multidisciplinary
Yes.
clinic, just like the one you mentioned.
Yeah.
It was great being able to see my doctor or a covering physician and be able to just walk down the hallway to
Yeah.
get blood work done. So
Yeah.
it was very simple,
Yeah.
one-stop shop, which
Yeah.
it worked quite well.
Yeah.
Are there any other solutions that you feel like might be helpful with the crisis that we're experiencing now?
One of the issues is overall accountability. And I've mentioned already how deceitful governments are, how they make decisions that they don't have to justify to anyone and don't face any scrutiny other than the occasional letters in the newspapers. Our federal government pays a very significant chunk of the provincial healthcare budget. And they are the ones that are subcontracting by the Canada Health Act the care of patients to each and every province. And there are national standards for care delivery outcomes, wait times, doctors per population, nurse practitioner ideal numbers, etc. Up until recently, the federal government, has never insisted on a report of quality control for the healthcare delivery that each province is supposedly doing. That's what they're getting paid for. And so the federal government, in my view, cannot hide behind the fact that, oh, we give the provinces what they're asking. That's irresponsible. The federal government should look for accountability of the dollars that they are pushing towards or into each province. And that may make the federal government look at maybe we should be insisting on certain basic changes like group practices or whatever because it's the only thing that will work. Because what we've been doing for the last several decades is not working across Canada.
Right. So having more oversight and
Yes.
accountability, you feel like would
Yeah.
really help solve
Yeah.
that problem.
And of course, the provinces say, mind your own business. On the other hand, if you look at the Canada Health Act, the federal government is responsible for the overall direction of care, and it insists that the Canada Health Act wording is carried out in each province, which it isn't.
Are you able to speak a little bit about some of the downstream effects of citizens not having access to primary care or having delayed access to care?
They're huge. First of all, you have a huge population that feels uneasy, or if they're getting on in years, very anxiety prone because what will I do if something happens and I've no doctor? So, and everyone wants to have a doctor. So you're already depriving the comfort that a huge number of people, you're depriving of what should be automatic, that they have a family doctor. Now, the effects of that, other than on the people themselves, is that diseases will go unrecognized, like early cancer may well become late, inoperable, untreatable cancer, that if there was a family doctor there months ago, could have picked up that lump or known what to do with the symptoms. You also have a huge overwhelming of emergency room departments. And probably, I can't say what it is, but I would make a guess that 30 to 50% of all the people in a busy emergency department could easily have been managed elsewhere. And that puts huge pressure on the resources, morale. It means that people in the emergency department are waiting for hours. They're getting iller, and the ill patients are not necessarily getting the attention that they deserve, because the limited nursing staff are running around looking after people that don't need to be in the emergency room. Then you will find that not having a family doctor means that preventative measures that a properly operating family doctor should be offering a patient, like regular blood pressure checks and maybe a blood sugar checks, are not being done. And if you don't recognize and treat blood pressure, then you increase the chances of dying of heart disease, strokes. It is the truly most preventable abnormality that a person can get that should be recognized and treated. And it's in the guidelines from the College of Family Practitioners. And yet, I have to say this, and my colleagues in the medical profession will accuse me of heresy, but I do know that the vast majority of people who do have a family doctor, who have visited their family doctors, from me asking people, it is clear that the majority of family doctors don't routinely check the blood pressure of a patient coming through their front door.
Mm.
So far, I've told you a whole pile of stuff. You can blame the government, the system, but you want a perfect system. There's faults on all sides that need to be corrected.
So, coming back to monitoring our different health outcomes, do you have some tips for listeners on how they can better monitor and maintain their own health?
Well, obviously, eat well, eat wisely, and do exercise, and don't smoke. So those things will save millions of lives. But from a point of view of measurable things, blood pressure should be done on every adult once a year, or when they visit the doctor once every few years. If you've had a normal blood pressure at the age of 25, you don't need to go back every year to have it checked. But if it was nearly high, then you're in line for a much higher chance of getting high blood pressure. So you should sit down when you're with your family doctor, who basically wants to get the consultation over with as quick as possible. There are notices in some family doctors' offices, one complaint only per visit, which is highly unethical. But you should ask the doctor, could you check my blood pressure? And it'd be interesting to see how many doctors say, oh, yes, and do it, or you don't need it. If it's the latter, then that's bad medicine. If you're middle-aged and a tendency to overweight, and especially if there's a family history of diabetes, that should be checked for, because the majority of people who get adult onset diabetes have it for years before it becomes clinically apparent. And in those years, irretrievable damage has been done to the blood vessels in the body, going to the brain, going to the heart, going to the legs. And that's why it has such a high mortality rate and morbidity rate. So again, especially if you have a family history of diabetes and your stomach is a little bigger than you think it should be, you should ask your doctor, shouldn't I have my sugar checked? And, maybe a lot of these doctors need these prompts. So if you control blood pressure and recognize and treat adequately diabetes, they're the single most preventative active measures in the whole of medicine, other than vaccination.
And what are your thoughts on folks checking their blood pressure at pharmacies or getting the at-home
That's
kits?
better than nothing.
Mhm.
And absolutely, if the blood pressure is raised, then you go straight, tell the doctor. So anyone who doesn't have a family doctor should go once a year, stick their arm in the machine. I don't know if all pharmacies have it now.
I think it's just some of them. Yeah.
Just some. So you have to pick the right pharmacy. And another aspect to that, and I'm not up to date on this, but there was a time someone did a scientific study and found that some of those machines were not calibrated regularly and properly. And there was no system built in to actually prove their accuracy. And in fact, some weren't. Now, maybe things have changed, and maybe that's completely incorrect what I'm stating. But it was a problem. But certainly, everyone should check their blood pressure.
Well, it's nice that we can take some of our health into our own hands and monitor some things ourselves. But
And stand up for what is needed to be done, and don't be inhibited in asking your doctor, well, shouldn't you check my blood sugar? My dad died of diabetes.
right, so coming back to sort of we're the experts on our body and our family history and advocating for the things that we think we need.
We should know enough about our bodies and our rights as living in a Canadian society to have optimum preventative care for common disorders and disorders that end up taking lives.
So, speaking of advocacy, can you tell us how you got involved with BC Healthcare Matters?
All my life, I have written letters to editors wherever I've lived. I'm kind of can't keep my mouth shut. And I had a couple of op-eds in the local Victorian newspaper. And I got a phone call from someone. He said, I love your articles, because one of the articles said, we need organizations who will go out and visibly protest, because that's the only thing that some politicians respond to. And he said, I've got the organization for you. And so within about 5 weeks, I went to my first meeting of BC Healthcare Matters, and I've been involved for the last few years.
Wonderful. So, was that back in 2022 then?
At my age, I lose track of time. It was shortly before the first rally on the steps of the legislature.
So, drawing from your experience with supporting the legalization of medical assistance in dying or MAID, what can you tell us that you learned from that advocacy project?
I learned a lot. First of all, public pressure is the only thing that politicians respond to. And Sue Rodriguez, when she went public with her devastating disease and says, I'm entitled to ask for medical assistance in dying, it was a talking point all across Canada. So you had a movement that then was supported by a national organization, Dying with Dignity Canada. You had several doctors who were working on that same wavelength to try and convince politicians. And you had, as part of the national organization, you had provincial chapters. So you had a whole pile of really interested people with backing, not just locally, but from the parent organization in Ontario. And that meant you could hold lectures, rent halls, workshops, whatever, and you wouldn't have to worry about getting funded to pay for the hall that you were having the lecture in. I was very fortunate that in Victoria and on the island here, there was a fantastic local branch of utterly dedicated people who worked with a small group of doctors who were unbelievably forceful in their advocacy. And so loads of our material did get published, did get recognized. We're on discussion groups that got national and provincial profiles. And that ended up causing the government to seriously look at this and come to. So, what it shows is when the public really wants something and are prepared to act, and that there are people who are prepared to conduct the choir, as it were, and help that action get prominence in the media, then it may well work. And it's just an interesting anecdote that Vancouver Island is the world leader in the percent of people who are dying, who die with medical assistance in dying. It's phenomenal. It's up to about 9% of all deaths on the island are medical assistance in dying. That's higher than the Netherlands. It's higher than mainland BC. And it's far higher than Ontario and Manitoba. So it shows once you sow the seeds of a culture change, if you have enough people prepared to go public with their concerns, that's what I learned. One of the reasons I get active in BC Healthcare Matters. It may work.
It's inspiring to be able to see that change, and that change is possible. It reminds me of one of my favorite quotes. I think I actually first saw it on a building, I think on Main Street in Vancouver. It's by Margaret Mead. It says that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has.
Mm.
And I think that's what's encouraging about groups like BC Healthcare Matters and the different organizations that are bringing more attention to these issues, is that we're concerned citizens. And if enough of us band together and support one another, we really can make a change.
Mm-hmm.
So, given all of the things that you've seen in your long career in medicine, I'm curious, what are your hopes for the future of medicine in BC?
I'm actually pessimistic.
Mm.
And the reason I'm pessimistic is the history of what's happened. Everything that's bad has been predictable. The falling number of patients, or the increasing number of patients without a doctor, take Surrey Memorial Hospital, gross deficits in their ability for a place that serves 1 million people. I'm not sure the numbers, but they've been completely neglected. And so your outcome, if you go through their emergency room door with a new stroke or a fresh heart attack, is absolutely going to be different than if across the river you were in the Vancouver General. So all of this is predictable. Our government in BC seems to be sometimes uniquely awful in that, for instance, take the case of physician assistants that have been shown to be cost effective wherever they have been introduced in America, Britain, France, any of the countries. And it's obviously why. It's obvious why they are cost efficient. Believe it or not, we don't yet have the first one installed in BC yet. And I personally spoke to the minister a few months ago at some meeting, and he said, well, we're getting there. Whereas if you look at Manitoba and Ontario, they've had physician assistants for a decade. There are 800 or 900 physician assistants across Canada. We haven't even got our first, and no definite plan by our BC Department of Health to reach a certain target by a certain finite time. To me, that's scandalous. And they're not accountable. And there's nothing we can do other than protest on our website. And if we have another demonstration, rally somewhere, that'll be a focal point. But our particular BC government seems impervious to signals that are obvious and need action to be taken. And therefore, I'm pessimistic. And if you were to tell me 15 years ago how bad the situation would get here, I would say you're talking nonsense. But we've become so accustomed to awfulness that I think is going to continue for years to come. We may permanently be in the lower 2 or 3 of economically developed countries from a healthcare delivery perspective. So I'm
Right.
sorry to be gloomy.
No, that's fair. That's your opinion, right?
Yep.
So it sounds like the normalization of slow delivery of care or not having a doctor is an issue sort of within residents. And then um yeah, just that compounding issue of not having enough urgency to act
Mm-hmm.
combined with the lack of strategic long-term planning,
Mm-hmm.
like you mentioned.
Mm-hmm. And one other thing that I should have maybe brought up is we talk about 900,000 people without a family doctor. Okay, so that's very inconvenient, anxiety proven, long time in emergency room, advancing disease, but it also causes increased deaths. And if you do the statistics based on several studies that have been published in America and elsewhere, it's almost certain that several thousand people die each year in BC alone who wouldn't have died if they had adequate primary care. So that's a higher number than died in COVID. And we went hysterical with COVID and did a good job. But the chronicity of the shortfall in family doctors just seems that we're prepared to lower the bar of acceptance.
Right. So it sounds like there are solutions to the problems that we're experiencing. It's just we need more support to encourage the government to take action on that. Would you say that's accurate?
Yes. Yeah.
And when we say the government, this is sort of an apolitical podcast, but we're just meaning whoever is in power because, like you said, this is not a new issue. It's been building for decades, right?
Yes. So since BC Healthcare Matters, we've been dealing with one government. Okay. And that's why some people said, oh, you're political. But in fact, if you go to the previous government, they had on their election platform to get into power that they were going to guarantee every citizen has a family doctor. And halfway into their rule, they officially abandoned that policy. They actually came out in public and said, that's no longer our policy. To me, so all governments, regardless of which party, they all are guilty of poorly serving the people that they're supposed to serve.
So, what would your recommendation be for listeners who feel fired up from listening to this conversation and
You
would like to
mean
make a
you mean
difference?
other than emigrating? Contact write letters to the newspaper, keep writing to your MLA, ask for meetings for your MLA, go to your church if you belong to a church and they have a social activist kind of group within the church, get them interested in specific healthcare issues. Join something like BC Healthcare Matters or organizations that actively advocate. Get out, don't advocate inside some committee room coming out with some report that will get buried in someone's filing cabinet. Come out and show by numbers that we're not going to take it anymore. There are organizations in Canada. There's one in particular, and it's typical, but it just happens to come to mind. It's called CARP, Canadian Association of Retired Persons. It has a multi-million-dollar budget, hundreds of thousands of paid-up members, and it advocates for this, that, better chronic care, better this for seniors, pension, something to do with pensions. It has never come out with, if you do a Gallup poll of what does a retired person really need and want, having a doctor is up there as numero uno for the vast majority of people. And yet this organization, I just read their most recent report and their previous annual report, never mentioned the word primary care. And we, BC Healthcare Matters, got in touch with them and said, we'd love to be part of you. Would you like to continue and support our advocacy? No, is the answer. So we can do a lot more in the public, but we need people to really advocate.
Right. So the more that we can work together and advocate together, the better the outcomes will be. And it sounds like our health really does depend on it.
Mm-hmm. I think so.
Great. Well, thank you so much for chatting with us today, Adrian. We really appreciate it.
Okay, you're welcome.
Remember, together we can advocate for the healthcare that we all need. The content provided on Your Healthcare Matters is for informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical concerns. The opinions expressed by guests are their own and do not necessarily reflect the views of the podcast or host.